I think the healthcare system has to really understand ultimately what is the value of any treatment. And we don't know what that treatment will be yet. But the first and probably the most critical factor relates to whether or not the drug is effective and safe. Even if the drug is effective, it might in turn only be effective for certain subgroups of patients, such as those who are the most severely ill or the elderly or what have you, and won't be necessarily recommended for other infected individuals. Also, the drug, whatever it may be, whoever it may be from, may not be useful for treating an individual infected for COVID-19, but it also may potentially be useful for treating new infections in the future to prevent future pandemics. So if we can reduce viral levels in terms of better treatments and to prevent secondary COVID infections, it might make the treatment very desirable from a public health perspective, who also want to be thinking ahead in terms of preventing future pandemics. I hope that helps.
So let me just also interpret that thanks for the hunt of the COVID-19 vaccine, we can also help the battle against other illnesses. Is that correct, Professor Asche?
Yes, we have to be proactive. All this work being done now. Think of many years ago with HIV/AIDS, how unprepared we were for that. Think of in the last 25 years, how much we were not prepared. We really didn't have a plan here in the United States, despite everybody saying they have a plan. And we have to learn from our mistakes, and we have to be able to better manage this in the future. This pandemic is costing us trillions of dollars. Hundreds of thousands of people are dying. Millions are infected. This is crazy.
Okay, thank you very much, Professor. And now, actually, I would like to invite Professor Katarzyna Kolasa. What do you think about what we've heard today from our two panelists? How would you underline this as an expert in health economics from Kozminski University?
Well, I'm so pleased to have such a great friends of mine and speakers. So thank you very much, Grażyna and Karl, for joining us. It's so important. I think that this is the moment of reflection for all of us, certainly. For me specifically, because when I'm hearing you, one thing that came to my mind directly, which is maybe we forget about it. The reason why we have this pandemic is climate change, the thing that we have 1 million viruses around us that are not detected yet, and according to the estimates, 30% of them might be another pandemic. So this is the real life experiment we are having. That has to learn us how to approach it into the future. So what you said, Rena. And I think the examples you have given, especially, I'm so thrilled to hear about those examples from GE. It's enormous value, and I think we need to highlight those even more. And I'm more than willing, Grażyna, to give you as many students as you would like to have to exercise them on those examples, because this is exactly what we need. If we're talking about that, we will change the safety of the healthcare professionals thanks to protection such companies as GE are introducing. Whether we think about the speed of the CT scanning, which we will have. And not to mention online training, which we need. Everybody needs. We are doing online training for our students, so it's the new reality, but which speed up things as well, right? So and eventually we'll have the access to treatment faster. And I think that's the most important thing. Although we might not have this human touch in the right time, but at least we'll have access to the treatment thanks to those solutions. And I think this is of great value. What I like, what Carl just mentioned, what we still miss in this part of Europe, I have never heard about any registry of COVID patient, and this is exactly what we need to have. So Carl, it would be very interesting to hear your follow-up on this one, because we need to learn. Maybe we don't need to have a vaccination program for all. Maybe those who have already gone through this COVID-19 disease might not be in the need of the vaccine tomorrow. They might be on the second or third wave, right? So it's so important to have a registry. As you said yourself, Carl, how to allocate the future resources in more efficient way. We need data, and this data are flowing thanks to those digital solutions we are having into us. We need to use them appropriately, and for that we need data scientists. So my mission at Kozminski is to train as many data scientists as we need for the future pandemic, and for the benefit of such companies as GE, for the benefit of such universities as University of Leona with the research centers. So so I'm extremely pleased, and thank you very much for your comments. Extremely valuable.